as a patient, that's the main people I'm making this video for, that you understand these are your rights, and that if at any time you're seeing a practitioner, no matter what kind of medicine they're practicing, they have to respect these things. So these are things where you could say to the practitioner, no, I don't want to have this treatment because it's your, like, that's number one. That autonomy trumps all of that. They can't force you or coerce you into having a treatment that you don't want to have. Medical ethics is something that's part of all kinds of healthcare, not just Western medicine, but it's something that doctors and healthcare practitioners all learn. And it's something that's supposed to abide by. And I'm not trying to make this video to say doctors aren't abiding by this or to have a go at any person or anything like that. Therefore, the decision-making process should be free of coercion or coaxing. And look, we're entering into a time where people, are feeling pressured to make particular decisions by society about their healthcare. And really, it's up to you as an individual. You can get the information and you should be empowered to make your own decisions. Hi, today we're going to talk about the 4 principles of medical ethics and how it might relate to you seeing your healthcare practitioner. My name is Hopkinson. I'm a Chinese herbalist and an acupuncturist from Perth, Western Australia. And I'm also a teacher, and this is a common question I come across as part of my teaching and also as part of what I've studied. Non-malfeasance can also have this dual implication, not just for the individual patient, but for society as a whole. So something could be beneficial to that individual patient, but for society as a whole, it could be quite harmful, and vice versa. There's often these situations where there's a conundrum there, and then it comes back to that beneficence. What's the most beneficial thing to give to this patient given these circumstances? The dictionary definition of autonomy is the right or condition of self-government, to make your own decisions by yourself, not influenced by other people. Obviously, practitioners are going to influence you if you ask them for an opinion. If you go to a practitioner and you say, hey, this is what's wrong with me, I'd like to know what you think. But at the end of the day, a practitioner has to give you autonomy. You have to make the decisions yourself. We can't make the decision for you, right? So if I could say to my patients, you need to take all these herbs, but it's their decision whether they take them. And if they decide not to, I have to respect that decision. So the same as with Western medicine, drugs, pharmaceuticals, whatever kind of options you're offered, right? So these things shouldn't be forced upon you. These are options that practitioners can offer you. And you as a patient have the right to decide. This is part of what's considered informed consent. So you might have heard this word bantied around a lot. Oh, you need to have informed consent, or we're giving you informed consent. Informed consent isn't giving you a piece of paper with all the information on it and hoping that you understand that and then getting you to sign, and that you say, oh, the patient signed the consent form. If they don't understand that, it's not informed consent. So it's your right as a patient. And the last one is non-malfeasance. So what does non-malfeasance mean? It sounds like a weird legal word. Well, it is a legal word. And what it means is to first do no harm.